There is currently some debate amongst therapists about the best way of managing acute soft tissue injuries, such as the muscle, tendon or ligament sprains and tears that we all experience from time to time, but are most commonly seen in sports injuries. So in this video, I'm going to look at the battle of the acronyms, RICE versus MEAT, or whether there may be a better way than either of these two regimes when it comes to managing acute soft tissue injuries. I'm Stephen Bunting. I'm a specialist MSK physiotherapist working in the UK. Welcome to my channel, where I discuss the common MSK problems experienced by everyday people and the evidence-based treatments that can help. So we've all had joint sprains, ligament tears and various other soft tissue injuries, haven't we? They usually get better within a few weeks or months, depending on the severity of injury. But what do we do with them during those first few days, when the pain and swelling might be a real problem? So you're going to want to know what the best way is of reducing that pain and swelling while still promoting the healing process. And if it's a sports injury, then no doubt you're going to want to return to your sport as soon as possible. And so you're also going to want to know the best treatment regime for optimum recovery. And that's exactly what I'm going to explore in this video, because in recent years there's been a change in how some therapists are now treating these injuries. From a research perspective, there is still no clear-cut answer, and so the jury is still out, but I'm going to explore the arguments between each side of the debate, and you can then decide for yourself which one might work best for you. Okay, so in the blue corner we have the tried and tested RICE regime, which has been around for many decades now, and indeed this was the only recommended treatment when I was qualified nearly 30 years ago. So RICE stands for rest, ice, compression and elevation, and the whole philosophy behind this regime is to contain and reduce any swelling and inflammation, and also to help with pain. So let's look at the individual parts of RICE. So rest is fairly straightforward. You should rest the joint, muscle, ligament or tendon from any painful movements. This is thought to prevent any further injury and to allow the body to initiate healing naturally. It doesn't mean total immobilization, but most people's interpretation of rest is to keep any movement to a minimum. Ice is an attempt to reduce that angry heat, inflammation and swelling, which is also the main cause of pain. It's recommended to use an ice pack for about 20 minutes every few hours. Compression is another way of reducing swelling and stopping it from spreading into other areas. This is done by using a compression bandage or one of those neoprene joint sleeves that you've probably seen. The elevation part is also another attempt at controlling any swelling. To do this properly, you should rest with the joint above the level of your heart, so as to encourage the swelling to drain back into circulation and to prevent it from tracking down into other areas by gravity. So that's RICE, and the proponents of this regime advise using it for the first 2 to 3 days after injury, before then changing focus to a steady increase in movement and exercise. But in the red corner we have the MEAT regime, and this stands for movement, exercise, analgesia and treatment. So the MEAT therapists argue that the RICE regime can potentially reduce the healing response by slowing blood flow to the injured area. They say that resting an area and using ice will reduce blood flow, which will slow the healing process. They also argue that swelling is an important part of that healing process, as it contains lots of growth and repair factors, and we therefore shouldn't be trying to reduce it. So MEAT is all about promoting the healing process. So let's break this down. So movement is fairly self-explanatory. And of course, this is the total opposite to the rest that the RICE regime uses. So therapists using MEAT will advise early movement of the joint or soft tissue immediately after injury, and then steadily increasing this movement throughout the rehab process. Early movement is thought to improve blood flow, prevent stiffness, and promote healing. Exercise really means just adding in some resistance work to the joint or soft tissue. So this might mean using some light weights or resistance band, or putting some weight through the area in order to load the injured tissue immediately after injury. This is thought to strengthen the tissues, improve function, and encourage early activation of the healing process. Analgesia just means using painkillers, as pain can affect your ability to move and exercise the joint. And to be true to the meat philosophy, this means just painkillers like paracetamol or codeine, and not anti-inflammatories. Because this regime doesn't want to reduce inflammation, because inflammation contains all those growth and repair factors which they are trying to encourage. Finally, the treatment part of the acronym is a bit wishy-washy, but refers to the use of collective treatments which are thought to encourage healing and repair, such as joint and soft tissue mobilization, massage, and some electrotherapy treatments, and also things like taping and the use of supports and braces to protect a joint while still allowing some movement. Okay, so those are the two opposing views. Now let's see what the research tells us. Well, the anti-inflammatory effects of rice have been well proven in numerous studies. Rest and ice definitely do reduce pain and swelling. But the question is whether this effect helps or hinders the overall healing process, and ultimately the return to sport, which is something that professional athletes are very interested in. More recent studies have shown that excessive use of ice can reduce blood flow and therefore potentially delay healing, and also that early movement can be more helpful than early rest, as that promotes stronger and quicker tissue healing. But unfortunately, there are no good quality studies that have yet been done which directly compare rice versus meat protocols in a real-world setting. Okay, so where the evidence is lacking and we have opposing theories, then we have to draw conclusions for ourselves based on current knowledge, but also real-world experience and common sense. And I would say that there are good arguments from both sides, and a hybrid approach taking the best of both regimes might be the best option. For instance, if someone has a lot of swelling after an acute injury, then we know that if that swelling spreads into areas of healthy tissue, then it can start forming scar tissue, which can prolong recovery. So icing in this instance makes sense. The argument for early movement rather than rest is a strong one, as the research tells us that movement promotes better quality healing and that prolonged immobilization can be harmful. So the sensible approach will be to encourage early movement as pain allows. But common sense must prevail. Clearly, if someone is in severe pain and they likely have a more serious injury, then a short period of rest might be sensible to help avoid any further injury and keep the pain under control. But if it's a mild to moderate injury and the person can move the area with mild to moderate pain, then early movement would be advisable. Because of this debate, a new acronym has been suggested called POLICE, which takes bits of both and advocates protection, optimal loading, ice, compression and elevation. So protection is there to help prevent any further injury by using taping, joint supports, crutches, etc. Optimal loading just means early movement and exercise as pain allows, so as to stimulate that healing response in the injured tissues. And then ice, compression and elevation is just the same, but it's to be used with caution and only if significant swelling is present. So basically, POLICE swaps out the rest bit of rice and advocates early movement, whilst also acknowledging that some protection to the area might also be needed in the more severe injuries. And then, after a few days, when the swelling has reduced, stop the ice, compression and elevation and progress the movement and resisted exercise. So basically, adopt the MEAT protocol. In this way, you can prioritise inflammation and pain control during the first few days and then transition into progressive movement and loading. And to me, this hybrid approach makes perfect sense. Police to start with and then MEAT. Simple. Okay, well that's about it. I'd be really interested to hear your thoughts in the comments below, as this is an area of much debate, and until some quality randomised clinical trials are done, then we're left with our own interpretation of the current data. Okay, well thanks very much for watching, take care and bye for now.